So welcome everybody to this meeting with Healthwatch Camden about the Omicron variant and the booster vaccination programme. My name is Dr. Louise Jones. I'm chair of Healthwatch Camden. I'm a medical doctor by background. I'm retired. I worked in palliative care at University College for many years. So we have with us tonight a panel of experts about vaccination and general, what it's like to be a GP delivering vaccination, what it's like to be a public health pharmacist, a public health doctor working on the vaccine programme. We have with us two interpreters this evening, Liz and Russell, doing British Sign Language. And if you would like to take advantage of their interpretation, please pin them. There's Liz, and Russell's already in action. And they'll be switching in and out every 15 minutes or so because it's, I think, quite tiring. We also have Norma, who's doing a speech to text. And if anybody wishes to use that, please click on the CC button at the bottom where you get a live transcript of the conversation as we go. We ask you please to keep yourselves on mute throughout. So unfortunately, we can't be interactive in terms of speaking in that way, other than amongst the panelists, but the chat box will be open. And so if you have any questions, do enter them in the chat box and we will try to address them throughout the evening and trying to be alert to new themes that might come on. I think that's everything for now. So the way it will work is that we have the the questions that were sent in advance. I have them written out and I will ask them to our panelists. So we'll go straight now to our panelists and I'll ask them to say a few words about themselves. So we'll start with Rachael Clark, who is Assistant Director of Medicine's Optimisation, Camden Directorate of the NHS North Central London CCG. Rachael, would you like to say a few words about yourself?
Thanks, Louise, and hi everybody. Thank you for inviting me to join this session today. So like Louise says, I'm Assistant Director of Medicine's Optimisation, and that means I'm a pharmacist who works in primary care with the GPs, community pharmacists within the borough of Camden. And I also work closely with all of the other medical teams in the hospitals and in the community in Camden to try and support optimising patients' medicines. I also have been heavily involved in the vaccination programme rollout in Camden over, over a year now, when we started the year last December. So thank you for inviting me.
Welcome. We move on to Dr. Frances Baawuah. Frances, would you like to say a word? You're a GP in Brondesbury Medical Centre.
Yes, can you hear me?
Yes.
Great. Hello, I'm Dr. Frances Baawuah and I work at Brondesbury Medical Centre. And I think I've been invited to speak to everybody today because I've been quite heavily involved in giving out vaccines and being clinical lead at many of the vaccine hubs. I also chair the vaccine outreach group, which is looking at perhaps understanding why people aren't so keen on the vaccine and understanding how we can improve uptake further. And so I hope I can bring that experience here today.
Thank you. Then we have Miriam Bullock, Dr. Miriam Bullock from Public Health Camden and Islington. Welcome, Miriam.
Hi, thank you. Thanks very much for having me. I'm Miriam Bullock. I'm actually not a doctor, sorry to disappoint. I'm a public health consultant, but non-clinical. And I work in the public health teams of Camden and Islington councils. And joining you today to speak about vaccination, which has been a focus of a lot of my work over the last few months in both the boroughs that I work in. So very pleased to be here. Thank you.
Welcome. Thank you for joining us. And finally, we have Dr. Tina Agrawal, who is GP and chair of Camden London Medical Committee. Tina.
Hi everybody, I'm Tina Agrawal. I'm a GP for the museum practice in South Camden, and I've also been involved in the vaccination programme as helping deliver it both locally in a South Camden hub as well as at the other centres like the Royal Crew and Headwater. Thank you. Okay,
so thanks everybody. So we'll get going, and we've got an hour. We will finish at 6:30, so we'll get going with the questions. The first question I have on my list is for Miriam. Miriam, the question goes like this: Is the apparent relative mildness of Omicron variant consistent with what we would expect to be the progress of a virus, or is it still likely that a more lethal or transmissible variant will emerge in the future? Miriam, what do you think?
Thanks. So I think a milder, more transmissible variant of the virus coming to be was not a surprise. And as we've come to understand a bit more about Omicron, it appears to proliferate more in the upper respiratory system, which explains its relative mildness. So it's mostly in the upper respiratory system, meaning, you know, kind of a milder symptom profile, but also that explains its increased transmissibility, it would seem, because it's, you know, there's more virus sort of being released in breath and speech. So it, you know, it sort of makes sense when we think of it in that way. But I think we can't assume that this virus or any virus will necessarily follow a sort of linear path of milder but less severe, milder but less severe. We just can't know that. And I don't think that any of the virologists that work on COVID would say that a more dangerous version emerging is likely, but it's certainly possible. And for that reason, so countries around the world, including the UK, are continuing to invest a lot in time and resources around surveillance, resilience planning, and vaccine development. And we as public health specialists and as a council are continuing to plan and prepare. So should a different version of the virus which requires different response emerge, then we'll be as ready as we can be to that changing course. And I think for as long as the virus is circulating, no matter what variant, vaccination remains the most effective way that people can protect themselves from severe disease, and that's regardless of the variant in circulation.
So do you think there'll be a need for a fourth shot? What do you think? What's your money on? Seems to me that it's quite likely, but I don't know. What do you think?
I think it is quite likely that the vaccination program will continue as a program and may become a bit similar to what we have with flu vaccination, where, you know, we have periodic annual vaccination campaigns. So I think that is the way that I see it going, rather than, you know, having three doses and then a fourth dose in quite quick succession. I think we're more likely to see something approaching an annual program.
Do you think that the fourth dose is likely to be directed at a specific variant, or do you think that I suppose we can't know that yet?
Yeah, so again, I think I perhaps draw a parallel with flu. So we know the way that the flu vaccination works is that it's we look at the strains that are circulating globally, and then marry the vaccine type that you know that goes into the shots to those circulating strains. And there's a lot of work going on at the moment, as you might imagine, in vaccine development world, looking at the different variants of the virus that are circulating and how the vaccines can be modified to better meet the risk that those particular variants present. So I think we will see that as going in that direction, where the specific vaccine is more tailored to the variants that we might see circulating in future, so it can be as effective as possible.
That's excellent. I think that would give us a lot of confidence, wouldn't it, to think that was going to happen?
Yes, I hope so. I mean, yes, that vaccine development is happening at great pace. There's an awful lot of work. It will not stand still at all.
No, indeed. So this leads us on nicely to the next question, which is for Rachael. As we can still catch Omicron, COVID, and pass it on despite being fully vaccinated and boosted, what is the benefit of continuing to keep vaccines updated?
I'm going to take that one. Yeah, I'm going to take that question.
Please do.
Yeah, so I mean, I think following on from what Miriam has said, it's very, I think, helpful to look at COVID like the flu. And as we know, every year we do need a flu vaccine to keep our levels up. One quite nice analogy that we've been using is thinking really about immune response and our ability to fight viruses and vaccines, a bit like a battery. So when you charge up your battery, that's when you have a vaccine effectively. And like all batteries and all things that require batteries, the battery power will reduce over time, and then if you charge it up again, then you boost it up again. And I think that's quite a nice analogy, looking at kind of antibody levels in the body. So we have high levels when we're either vaccinated or we have the infection. This reduces with time, and then we need another booster to charge the battery, as it were, to increase those antibody levels to help fight severe infection and death. And I think that's really, really important, that actually this is all about stopping severe infection and death. So that's hospitalization, people becoming really very unwell with COVID, and not necessarily catching COVID. We'll come on to that a bit later. But I think, it's really important for people to remember that the whole purpose of vaccines, this vaccine particularly, is to reduce the incidence of severe infection, i.e. hospitalization and death, as opposed necessarily to perhaps catching COVID.
And someone's asked in the chat, if we don't know what the variants are, so they're going to come at us from left field or whatever, how are we going to be able to develop the vaccines? And so I don't know if you'd like to say something about the sort of central core battery that we're going to need, I guess.
Yeah, and I think that we've demonstrated that really nicely with this current wave. Omicron has hit us hard and fast, perhaps not as hard in terms of the death rates going up, but I think there's no coincidence that clearly there has been a very, very interesting correlation with death and the emergence of the vaccine. And even as a clinician, I can tell you that in Brondesbury Medical Centre, my practice, all practices, they get the results of everybody that tests positive on PCR. And we've been notified for quite some time now. We have a protocol in our practice where if you're over a certain age or if you're high risk, we proactively contact patients just to make sure they're okay. Now, when we were doing this pre-vaccine, it was a really hairy consultation because often those people were in hospital or they were very unwell. Vaccines came out and we were calling 80-year-olds with COVID who'd been double vaccinated and they were at home, a bit of a cold, they weren't feeling great, but they weren't in hospital. And this is something that was really, really quite reassuring for us all to see, that vaccines really were doing their job in preventing severe infection and death. And I think that's the really, really important thing, as I say, for us to bear in mind here.
Thanks. Rachel, do you have some data on the effectiveness of the vaccine against Omicron?
That's right. And like Francis said, the key thing is that, yes, the booster does provide a high level of protection against. So I've got a specific question in relation to the booster and the efficacy. So the boosters do provide a high level of protection against death with Omicron. So at 6 months after the second dose of any of the COVID vaccines, protection against death with Omicron was around 60% in those age 50 or over. But that increases to 95% 2 weeks after receiving your booster dose. So really important, that protection against death. Like Francis said, the protection against milder disease, there is evidence that against that sort of milder symptomatic disease with the Omicron variant, that the protection does wane and is lower than the previous Delta, the previous variant Delta, which the vaccines are effective against. But importantly, also is that there is a very high level of protection against severe disease, and that's hospitalisation, and that's including in the older adults. So, for example, if after the Pfizer booster, after you've had any first or second dose of any other vaccine, the vaccine is effective against hospitalisation at about 90%. And that drops to about 75% after 3 months. But if you remember that the World Health Organization's bar as to what efficacy is, so what effective vaccine is at about 50%. So 75% is still very good against hospitalization. And from the Delta variant, it's 93%. But just as a reminder for people, and to give you a bit of local information, so in North Central London, we currently have 1 in 5 people in hospital in a bed have COVID. So 20% of people still in hospital have COVID. So really important that people are vaccinated. And we've given in North Central London, just a few facts on how many vaccines we've given. We've given over 1 million people a first dose now. and we've given nearly 1 million people a second dose, and we've given about 670,000 people booster doses. So a large number, and that's just in our local North Central London area. So just as a summary there, the evidence does show us that the vaccines do help prevent, to protect us against particularly death and severe disease with COVID, and protecting particularly those most vulnerable in our society. And the vaccine is the best way to increase your protection, with the booster, like Francis said, topping up that battery to keep your immunity high.
So if, I don't know whether Francis wants to answer this, if people are having trouble accessing the booster, for whatever reason, what's the best way? I know there are drop-in vaccine clinics. Sometimes the app doesn't work. I don't know why, it might not. But if you go to, is it all right to ring your GP, or what would you suggest to someone who's stuck, can't get what they want?
I think Rachael is as equally good as me, but certainly I can comment as our practice is that if people call up, we will often know where is locally providing it. The kind of the regularity of it is reducing now that the demand is less. So before, there are places that were just doing it every day. Now that's not the case, but certainly there is we can signpost people as to where clinics are being held. And I don't know, Rachael, if you can help further there.
Yep. So in Camden, we still have 4 what are called local vaccination service hubs live, like Francis said, in less days of the week, but we have 7 community pharmacies that are open on most days and weekends as well. And we also have Bidborough House, which is open regularly in Camden off the Euston Road. If you go to the council website, to the CCG website, or if you Google Grab a Jab, etc., you'll be able to find a vaccination service. But don't forget there are local community pharmacies on the high street that you can walk in and get
so many are walk-in, and so anyone is entitled to the jab, so long as it's how long since their previous dose?
It depends, but say the boosters after 3 months.
Yes. After
their second dose, but the schedule is quite complicated with other people with certain conditions. So always best, you can always go to your pharmacist any pharmacist on the high street, and they can advise you and then signpost you to a service, or like Francis said, if you are speaking to your GP, they also will signpost you. And if you've got any specialists that you're in talking to as part of your care, they can also signpost you to services.
Okay, thanks. And Francis, can you tell us what you think about waning, the effect of the booster waning? Because there was some publicity about that a while ago, wasn't there, that waning did happen?
That's right. I mean, waning is there for all vaccines, and I think that's a really important thing that we need to try and do, is remember that this isn't just this COVID vaccine. In terms of the booster, the difficulty with the antibody levels that we're measuring is that we don't really know yet kind of what level it gets to, we don't know what that magic number is, and waning is seen. And this is why we're giving the boosters, because we just think that we want to make sure that the antibody levels are high enough. Waning is happening, but as I said, I don't think that is over and above what one would expect for other vaccines. And certainly what we do know is that even with some waning, you still have protection. It's just less a percentage of severe disease.
Mm-hmm. That's really helpful. And long COVID, do we think that the boosters have any effect on long COVID, or are we not sure yet? I don't know who wants to take that.
I will. Yes. There isn't as much data about this as there are some other aspects, but quite a large study was published about a fortnight ago, showing that vaccination reduces the risk of long COVID by 50%. And I think that's a particularly important point for our younger adults, actually, because we know that younger adults are at much lower risk of severe disease, hospitalisation and death as a result of COVID. But they are nonetheless as at risk of getting long COVID and being quite unwell for some weeks and months. That can really take you out of work, sports, socialising, all the other things that you want to do. You're effectively, but you can be burdened by this virus for months at a stretch. So whilst you might think, well, I'm not going to have to go to hospital, so what's the point of vaccination? You know, that's for people who are older. It really can offer a huge amount of protection against long COVID. And so if you do contract the disease, you know, you're looking at a much likely less severe version, ill for a shorter period of time, and a much lower risk of those ongoing long COVID symptoms.
And so for people who've already got long COVID, should they get boosted?
Yes. So yeah, having long COVID doesn't affect the fact that you can still get your booster. I mean, there's a recommended window of time that one ought to wait after having COVID infection before having the booster. Yes. But long COVID does not affect that. And yeah, I would advise against imagining that just because you unfortunately are experiencing long-term symptoms, that doesn't mean that you are protected against the virus, and so you should still look to follow the normal vaccination and booster schedule that you would for post-infection.
Okay, thanks. So while we're with you, Miriam, could you tell us a bit about vaccination rates in Camden? And we see on the dashboard, the NHS dashboard, if we look at the figures every day, see these big plots with all the little squares, and we see that nationally the rates are very good, but London is not quite so hot. And I wonder if you could tell us a little bit about that.
Yeah. So you're quite right that that inner London boroughs have lower rates of vaccine uptake in pretty much all groups, all age groups, compared to the national average, and Camden is within that. Really, we tend to think of it as being a feature of our population. So we know that vaccination rates are lower in younger people, so younger adults, and in populations that are more mobile, and in populations of diverse ethnicity, we see lower vaccination rates. And so all those things, all those factors are present in Camden and other and across central London, and it's that which is to which we can attribute our lower overall rates of uptake.
Okay, and what are we doing to try and help with that? What sort of measures are there?
Yeah, so there's a few. I think because we're talking about quite a lot of reasons why we see lower uptake. There are a few different approaches that we need to take to try and counter that. So some of them are practical, so making sure that vaccination remains available, that there's flexibility around appointments, flexibility around opening times, but a lot of it, I think, is about engaging with our population overall, and particularly in groups who seem less confident in vaccination, whether that's in its effectiveness or the need for it. So we're actually embarking on quite a substantial programme of community engagement work around health and vaccination in Camden, which will be taking place over the next sort of 6 months. And I think that's providing a really good opportunity to listen to individual communities, understand what their barriers and concerns are. If there are things about providing really local information, would people find that helpful? Is there something about greater flexibility of our delivery models? But really, I think it's about, we're at the point now where we realise we need to have really open, honest conversations with people about why is vaccination take up lower in particular population groups, and how can we talk to you about, they're not about telling people what to do or persuading people or making people take the vaccination, but just making sure that everyone has access to honest, accurate, reliable information, so that they have that in order to make their decision.
It's really helpful. So I've seen the vaccine bus going round.
Yeah.
And someone has a question has come through saying that someone has got their booster jab at the vaccine bus, but their records haven't been updated. And so to be able to access their COVID pass, obviously they need their records. So I'm not sure whether this is a specific problem, or is there some way in which we can advise as to how, obviously records should be updated through the vaccine bus, but is this a common problem, or is this just a one-off? Or could you make a comment, either Miriam, either you or Rachel?
I was going to say I wouldn't imagine that's a common problem, but it's definitely something we can look into for that individual if they're able to contact us. But Rachel, please.
Yeah, so it shouldn't be a common thing, but if people do have a problem with that, if they've had their jab on with us, so I've got an email address that I can give the Healthwatch team, and that's the council's email address. And if you give your full name, your date of birth, address and date and location you got your vaccine, what they will do is talk to the clinical team and they will update the records, make sure the records are updated. I've also got a phone number that people can ring as well if they don't want to access that via email, but that can be resolved, but it shouldn't be common at all. No.
Okay. And for people who can't access the NHS app and they need a COVID pass to go travelling, say, how can they get a pass?
So you can ring 119 and you can order a paper copy of the pass, or you can go onto the website and you can request a copy. If you don't want the app, but you can access the website, you can actually you can ask for a paper copy via the website, but other than that, you can ring 119.
Tina, did you have something to add on that?
No, I was just going to say also, it's going back to the rates of vaccination being low. It's a smaller factor, but it's just also we live in a very international community, so people have had their vaccines abroad, and sometimes the data doesn't reflect that. And it's been quite a mammoth task trying to get those vaccines onto the NHS system, which people can now do through 119 and the online service where you book an appointment to a vaccine centre to get some of that information transferred. And I think that will definitely add to the data or the vaccination rates, but we obviously recognise that there is there are several factors to play. And as GPs, obviously we have on our computer systems when people aren't vaccinated or their vaccination status isn't complete. So we do have little pop-ups. So like with anything else in life, we do lots of opportunistic conversations to just to check in to say, have you changed your mind? Do you know where to go? Is there any, are there any questions that you need help with or that concerns or worries? So it was just to filter into those two questions as well.
Okay, that's really helpful because we at the moment, the rules change all the time, don't they, about vaccine passes? But if you do want to go abroad, I think other countries are very strict about the vaccine passes. So you have to upload the information before you travel, and I think even when you're in the country, you need to use the vaccine passes. So I think it's a very important practical question for people now as the spring comes on, and maybe people will want to travel a bit more, and the rules are lightening up. So that's really helpful. Okay. So Francis, I think this question is earmarked for you. So we're talking a bit more about services now, which we sort of come round to in our discussion. So Omicron and COVID have not caused us any direct problems. Will you ever revert to the kind of care where GPs actually see their patients as to diagnose their conditions, or have viruses changed care forever? And I think it's a concern that everyone has. But I think that actually GPs are working very, very hard, and that you can see people face to face. But it's just people's perception perhaps isn't that. So
yeah, I think so. I think it's really, this is a really good question. I mean, I think people forget that things are really fast moving, and certainly people seem to think that our doors are closed, and they're really actively not. Certainly I can talk about my practice at Brondesbury. We are seeing patients face to face. The doors are very much open. We often do ask patients why they need to come in, to make sure that the people in the practice are people that need to be there. So for example, if you needed a prescription, you didn't really need to come in to do that. We could do that on the phone, or we can address that another way. So it's just about, whilst the restrictions were in place and we were having to socially distance, making sure that the people in the practice were those that needed to be. So for example, we were doing all the smear tests, childhood immunizations, all of the routine stuff is still happening. But I appreciate that patients might have found it more difficult to get in touch with doctors. And another thing I think that's really important is that, of course, COVID affected everybody. And so we had huge sickness levels on the practice, unprecedented members of staff who were off sick. And I think we, were fairly good practice, but we, 17 people, administrators and doctors had got COVID in December, just in our practice. So you can imagine the impact that has on services that we can provide. Going forwards, however, I would really urge people to if you do need to see your GP, please do contact them. They should be seeing you. There isn't anything, and I think, Tina, I'm going to give this to Tina because she obviously is part of the LMC and the bodies that kind of that delegate this, but we are actively seeing patients, and it's really important for patients to know that if they need to see a doctor, that they can.
Yeah, so I was just going to add that actually throughout COVID, most practices, the average was 50% of routine appointments were face-to-face. So that's still that they are seeing people. And in November, December, the volume of appointments have gone up 28% in NCL. So GPs are delivering more and more appointments. They're not all face-to-face, but we also have to use different ways of seeing and talking to people in order to keep up with demand. You need to operate 24/7 if you need to see everybody face-to-face. And I'm sure a lot of people wouldn't want to come in for a blood pressure check at 2 in the morning, nor could we actually function like that. So, trying to do things in using different tools for different people is really important. Lots of people don't want to wait in a crowded waiting room for a clinic that's overrunning for half an hour when they could have that dealt with over the phone in 5 minutes. But for someone else, that's really important to have that contact. So it's trying to build in a hybrid model that works for everybody and also can cope with the quantity and the demand that's needed as well. Like hospitals, we're also in a recovery backlog. We're catching up with lots of active and routine care. So yes, we will see people. We might just not be able to see everybody at the moment that they want to be seen. I hope that's helpful.
I think that's very helpful, and I do appreciate how difficult it is and how difficult it is with staff going off sick, and that's been a particular problem with Omicron, hasn't it? Of people not being available. I wondered what the latest government position is on compulsory vaccination for NHS staff, and whether this applies just to patient-facing staff or to everybody in the system.
So I'm taking that one, I think, Louise.
Yes. Okay.
So the latest position is the Secretary of State announced the government intended to revoke the regulations requiring vaccination as a condition of employment. People may have heard that referred to as BCOD for healthcare workers, but this is subject to a parliamentary process and review, and there's currently a consultation open to the public on them changing and revoking these regulations. So that consultation is open to the public until the 16th of February. The government have written to NHS leaders and employers that they do not serve notice of termination of employment to staff affected by these regulations at this moment in time until the outcome of the parliamentary process is concluded and further information and advice from the Department of Health and Social Care. They have been clear, NHS England, obviously, with staff that we have a professional duty to be vaccinated, and it does remain our best line of defence against COVID. So there's still encouragement and support for staff as well as patients in terms of giving good information to inform their decisions so that they might come forward for vaccination to protect them, not only themselves, but also their patients.
Thank you. While we're on talking about services and access and people feeling able to get in touch with their doctors and their healthcare providers, I think it's very empowering in some ways for things to be digital, and the hybrid system, I'm sure, has made a very big difference to the capacity to deliver care. But I wonder what thoughts maybe Tina and Francis have on, or any of you have on, what happens to people who can't access the digital system. So we alluded to it a little bit about the COVID pass, but in general, what do you think, Tina?
I mean, we've always had an open door policy. We are here to help support people. We understand lots of our patients don't have mobile phones or enough credit to do things, so we will help support them. Some things, have moved into the digital stream, and there isn't something that we can influence. So, for example, like when it comes to booking blood tests, it's an online platform, but we will do that for them. We will help print out the forms. Our reception staff will do that. You can, you don't have to book an appointment over the phone or online. You can walk into the surgery. Obviously, before, at the height of the pandemic, that wasn't encouraged in the same way, but it was still there for those who can't do it. So there are lots of means, and we are here to support. Remember, most of us as GPs have been in the practices for a long time, so we know our local communities. We know which patient has issues or specific needs, so we are mindful to that. And very much, it's not a one size fits all, and that's why I suppose we're making life more difficult, because we have to have such a varied and hybrid approach. So the appointment systems become even more complex, because you've got different slot types to try and cater for everybody. So that it's not the online savvy who can take up those appointment slots, but actually we have to share them out. So some for phone, some for face-to-face, some for online technologies.
I suspect some of it is that we remember how it was at the height of the pandemic, and I think perhaps the public in general has lost confidence going into GP practices. So I think the public needs to regain the confidence, and the practices need to be welcoming. And I think
demand is outstripping supply. So general practices lost a lot of general GPs and other health professionals just through normal retirement and workforce issues. So we are trying to do more with less, and demand is up, and we can understand why the demand is up. It's just trying to balance it with the resources we have, which is hard. And we appreciate that people are, we're very sorry that people are having to wait for appointments and things like that. It's not ideal.
Miriam, could you talk about the role of pharmacists in helping support not only the vaccine programme but GPs, and what people can do if there's difficulty accessing their practice for a variety of reasons, or people feel they're not sure what to do, where to go? They can go to their pharmacist, can't they?
Yeah. I mean, pharmacists and Rachael, I'm sure, is very, very well placed to advocate for the role of pharmacists. But there is a huge amount of advice that the pharmacists can provide, and they're very accessible on the high street, always available to speak to people. And yes, if it's an issue that they can't deal with, then of course they would be advising people where else they can access appropriate care. But no, pharmacists are a wealth of knowledge and expertise on a huge variety of conditions and concerns. So yeah, definitely advocate for people.
Do you want to add to that, Rachael?
No, absolutely. Just to say, we're trained clinicians that are available and accessible not only in the local community, but they generally have very good opening hours. And like Miriam said, if the condition isn't something they can't manage, I mean, they're used to managing many particularly self-limiting minor conditions, but if they know how to refer on to other services, be that the GP or to other health professionals or other services, they would know exactly the right point in which to refer you to someone else if it wasn't something they could manage. And that's not just yourself, but also your family, your children, anybody else who's part of your family they can advise on.
So somebody has asked about feedback and how we're able at the sort of organisational level to understand patient feedback about access to vaccines, access to GP appointments, access to medicines of all sorts. So I think, Rachael, that your timetables to answer that question, but it sort of leads on from all the other things we've been talking about.
Yeah, so I think we've touched a little bit on why, so particularly in terms of those access to appointments, etc., why in the pandemic we reverted to bringing forward some of the digital first strategies and the triage. But like GPs have said, they've always been open and are still open for face-to-face consultations where appropriate. So at the moment, for example, the GP practices themselves have patient participation groups, and they're always welcome to hear feedback from patients, including any complaints, to understand patient experience. And there is an annual patient survey that is also done where information can be fed back. The CCG, which is who I work for, they also continue to hear feedback from residents. Now that might be through ad hoc information, it might be through complaints, but we also have a Camden patient engagement group, and I saw Mark's on the line and a few others from the team there, and they would work with us to look at those. There's regular Healthwatch conversations, and obviously this has been organised by Healthwatch. So, I mean, that's locally, but across North Central London, there has been a review being done to look at insights into our communities around the barriers to accessing primary care. And they have been forming an improvement plan using what's called the Winter Access Fund. So we've had some injection of some funds to try and support that work. So that's looking over the last 18 months, what residents have felt and learned about, what they thought about online consultations and also access to appointments. And that would be continued, that work with the Healthwatch organisations across North Central London. I mean, in relation to primary care, we do work as one big team and, you know, keep in check with practices to see what their situational status is regularly, to see what the pressures are in the system and if there's anything else that can be done to support any practices. But you know, it's likely that this hybrid is here to stay. We've learned many positive things, but also learned other things. And there's regular review, not only of this, but moving on to the vaccination programme as well. We've learned so much from working at scale in the vaccination programme. The links we have between the NHS, the council, the voluntary organisations in our borough are really strong. And we're really keen to make sure that we take this forward for other health interventions, for any other work that we might do with our communities. We really have got such a strong links now, but also looking at care at scale as well in terms of the hub approach. So we're quite keen to look at that, but also then the really what we call hyper-local approach, where we go literally into a community. And with the vaccination programme, we've literally been knocking on doors, you know, and going into each road because we've been able to get data as to the vaccination uptake in really local communities, which has really helped us to target where we put our energies and our resources to help people.
Yeah, I mean, I think the other thing is about other sorts of vaccinations and childhood vaccinations and all those sorts of things that need equal attention over the year, and also screening programs and so on, to make sure that we're up and running with our preventive programs in the way that we were 2 years ago. So I think that's really important for people to remember. I wonder if we could talk about natural immunity and the relative efficacy of vaccinations and natural immunity, and where the conversation is about herd immunity, because with Omicron, I think we're not all going to get it, but I think possibly we are all going to get it at some point because it is so infective. So herd immunity is a real question, and whether what the conversation is really about naturally acquired immunity versus vaccination. I'm not sure who would like to start off with that question. Miriam?
I'm happy to start, and then clinical colleagues
Yes.
can add. So the natural immunity versus vaccine acquired immunity, I think that the real issue there is that with natural immunity arising from COVID infection, it's a complete unknown, really. Immune response varies between people. It is much less predictable, I think, than immunity that's derived from a vaccine, and there isn't the data isn't as reliable, you know, as compared to data around vaccine acquired immunity. So I would advise anyone who is thinking, oh, I've had COVID, so I'm going to be immune. You know, I don't need to. The vaccine is not going to benefit me. I'd really counsel it, against that line of thinking, because if you get your vaccination, then we know that offers you a really strong level of protection. Whereas we just cannot be as confident about and the immune response that's generated through natural infection. So I definitely advise that people do not rely on a natural infection to have given them that immunity. Always best to get the vaccination doses to get that topped up, as we've said earlier. And I don't know if clinical colleagues would add anything to that, Frances, maybe?
Yeah, no, I was just going to say that, you know, in terms of what we can see from the data, I think it's also clear that people who are vaccinated not only have a shorter duration of disease, of the illness, but also are less likely to be admitted to hospital and have serious infection. So I think that, you know, those are the things that we are seeing. It's still very early days. And, you know, as I say, going back to the beginning of the conversation about looking at boosters and when the next one might be, you know, there's still a lot to be said. A new variant might come out. All of these things can happen. But fundamentally, what we don't want is to see the, you know, the 1,000 deaths a day that we were seeing at the peak of this, which was just awful.
Absolutely. Tina, I don't know if you have anything to add. Or Miriam, sorry, did you want to come back?
I was just going to start on herd immunity, but Tina,
yes, please.
Oh.
Please do.
I've got nothing to add.
Okay.
We're all too polite. Yeah, so herd immunity, I think it is not necessarily a useful concept for this virus, because there's too many unknowns about the duration of immunity. And you know, we think of herd immunity with things that are much more predictable, like measles, for example, where we know that the vaccination provides what we call sterilizing immunity, meaning that you cannot then acquire the virus, you cannot then transmit it, and it's not quite the same picture with the COVID vaccination, which is more about protecting you from severe disease and lessening the symptoms that you might experience. So I think we can't really have as much confidence in the idea of herd immunity. You know, obviously, with a higher proportion of people vaccinated, with a high proportion of people carrying some natural immunity from COVID infection at any one time, there is a measure of herd immunity in the population there, and that lots of people will generate an antibody response if infected. But I don't think that we could rely on herd immunity, you know, say that this is a level that we've reached, and therefore that will influence what we do around the vaccination program. I don't see it for COVID. It's not that kind of virus.
Yes, I think that's a very interesting comparison. And I think, what about flu? How does it compare with, obviously, if we have to have an annual vaccination and there's a change, relatively small changes in the virus during the year, that's what happens with flu. That's why we are comparing it to flu now. So we get an annual flu jab. But how does flu compare in terms of herd immunity question? I guess it's more like Omicron or more like COVID than it is like measles.
Yeah, I don't think we really think in terms of herd immunity for flu, because we it's a bit similarly. We're not quite as able to rely on the vaccine as we are with some other diseases. And comparison with flu and different circulating strains, etc. With flu, as with COVID, it's transpiring. We have different variants of the virus. You know, you can't see, but I'm doing this and with my hands circulating at any one time, and yeah, that influences how much we would be able to say we'll achieve herd immunity. But yeah, as I mentioned earlier, I think it's likely that COVID vaccinations will go the way of flu vaccinations, in that there will be different variations of the vaccine that are more effective against different variants of the virus. And we may find ourselves, with combined vaccine products, as we do with flu. We may find that with COVID as well, that we have versions of the vaccine that protect against multiple strains, multiple variants.
I think we're very lucky, are we not, that the vaccine has been developed so quickly that any side effects usually show very quickly, and that long-term side effects are not being observed. Absolutely. I mean, as has been mentioned earlier on the call, if we compare the level of hospitalization and deaths in the more recent Omicron wave to the previous waves of COVID that we saw, when the difference is just huge.
Yeah, it is just extraordinary, and that and that is due to such a large proportion of the population having been vaccinated. So yeah, we're incredibly lucky, and to have access to vaccination, in the way that we do compared to some other countries. Yeah, incredibly.
Absolutely. And we rely on.
I would just like to, sorry, Louise, because you just said that, you know, it was developed very quickly, and I think it's really important to stress that that didn't compromise on the safety.
Yes.
And certainly the technology of the vaccine is something that has been going on for many, many years with other
Absolutely.
viruses, and that, you know, it's not that this was kind of a quick thing. It was more that COVID piggybacked on research that's been going on for years and years, because it had lots of money, because it had lots of participants who were willing to be, you know, randomized into trials, and because we just really were throwing everything at it in a way that we've never done historically with anything else. So it has certainly didn't compromise on the safety of the vaccine.
No, that's really helpful. I didn't mean to imply we had, but I think it's really helpful to say that very clearly, that that is the case, and that the effectiveness is very, very high. Yeah. Okay. Do you think there's anything we've overlooked to say? We've got 5 more minutes, so we will be stopping in 5 minutes. So is there anything that you feel we haven't covered? I think we've covered most of the questions that have come up in the chat box and that I've received on my WhatsApp from the team. I hope that we have enabled people to understand more about Omicron, about the booster program, about how to access it, about how to access GP services in general, and about how we're doing in Camden. And I wondered if there were any sort of take-home messages. I don't know if perhaps we should just go around. We've through all the questions, so maybe we should go around our 4 speakers and see how they would like to sum up their views. Tina, should we start with you?
Sure, I suppose, I mean, just to sort of say that obviously it's been a challenging time for everybody the last 2 years. Hopefully we can see green shoots in the summer coming through, and, you know, but we all go to work to do a really good, try and do it our best. So we're really sorry when we don't meet everybody's expectations, but, you know, just be patient, do keep trying. We will be there, we are there, as is the rest of the health service, trying to just piece back together the enormous demands and responsibilities that we have. But thank you for being patient and listening.
Great. Frances, I'm sure you echo those sentiments.
Absolutely. Thank you, Tina. Completely. Yeah.
Rachael, did you have something else to say about your role and the challenges that you have just now?
Sorry, I'm typing in the chat the phone number for you all.
Oh, brilliant. Great.
And the email address for the queries.
That's really helpful.
Yeah, no, I mean, it's been a privilege to work on this vaccination programme, and like I said, I think we've got some really strong links in our communities. Not that we didn't before, but we've been working in this pandemic has brought us all together really strongly, and we'd really like to make sure that we take that forward, going forward to support patients and many other things. And, you know, a big thanks to everybody as part of the programme, not just, you know, the clinicians, the managers, but also the volunteers. They were such a fundamental part of the vaccination programme, and still support us in the vaccination centres. But without all of the volunteers and the communities working with us, it really would have been a lot harder to do. So thank you to everybody.
Thank you. Miriam.
Thanks. Yeah, I'd echo all that colleagues have said, really. And thanks to everyone who's come along tonight and tuned in and submitted questions. And thank you for having me on the panel. It's been a real pleasure. And just want to emphasise that, you know, that vaccination is here, it is available, and there are good sources of reliable information out there for anyone who still, you know, has questions. And if you do have any particular questions or concerns, you can just drop into a vaccination centre, drop into a pharmacy, have a conversation with a clinician, you know, speak to your GP. You don't have to get vaccinated there and then, absolutely no obligation, just, you know, go in for a conversation. And just to say that whilst demand for vaccine is lower at the moment than we've seen, we're still seeing, you know, 500, 600 people a week coming for their vaccination. So you haven't missed the boat. And yeah, people are here for a conversation, any questions you might have any time. So yeah, we're always here.
Thank you very much. Okay, everybody, I think we can draw the meeting to a close now. Thank you very much for everybody for participating, particularly to our speakers and also to everyone who submitted questions and has listened patiently to us while we've gone through. So there will be, the meeting has been recorded. The video will be available on the Healthwatch Camden website in the next few days. There will also be a transcript, and we will also put up some of the key pieces of information on our website, some of the numbers and the contacts and so on that colleagues have very kindly submitted now, and anything else that we feel is useful, and the link to where to find your vaccination centre and so on. So if anyone has any questions that they feel haven't been answered, please do send an email to the team at Healthwatch. And we also, we try and answer questions as quickly as possible through the email, or also you can always ring us at our telephone number. All our contact details are available on our website. So thank you very much to everybody, and I hope you go off and have a nice supper now. So thank you to our interpreters and to our screen our voice to screen digital service as well. So thank you very much indeed, and I'll say good night. Okay, bye-bye. Bye.
That wasn't too bad, was it?
No, indeed.